Good afternoon, my name is Terry Rudd. We're going to do a little demonstration here of a head-to-toe assessment on how you can rapidly and efficiently do a head-to-toe assessment in a pretty short period of time. A head-to-toe assessment should be done at the beginning of your day so that you have baseline data, and depending on your shift you may need to do that assessment more than one time. We have a 23-year-old male patient who had an appendectomy 2 days ago. Normally he would have gone home pretty much the same day, but he had a little bit of a fever. So as a result, they kept him in the hospital so that they could administer IV antibiotics. These are his vital signs, and I'm coming in to do my head-to-toe assessment. I do want to let you know that I've already washed my hands, and going in at this point in time as if I'm knocking on the door. Good afternoon. My name's Terry. I'm going to be working with you today for the next couple of hours. Well, I heard you had your appendectomy a couple of days ago. How are you doing? I know you've been having some pain.
Yeah.
And how did the medication work for you?
It's been helping. It just starts hurting a lot after it wears off.
Well, I'm going to go ahead and check you over and do an assessment, if that's okay. We'll get some baseline data. And then your medication's due in about an hour, so I'll make sure to come in and check with you and give you some more so that we can keep that pain threshold up. Okay? Okay, good. Okay, I'm going to be checking you over. Can you tell me your name, please? David. And David, where are you today?
I'm at the hospital.
At the hospital. And what month is this?
October.
October. And why are you here?
I had pain on my side and I came to get checked out. Doctors told me I had the sinus.
Okay, so basically when doing orientation check, you want to do open-ended questions so that you don't get yes/no on your questions. And then also, as far as time orientation, it's not fair to ask the date. Ask the month or the year or something general like that as far as that goes. Now tell me about your pain. Where is it located?
It's on my right side.
On your right side. And on a 0 to 10 scale, with 10 being the worst pain, how would you rate that?
About a 4.
About a 4? Okay. What makes it better?
Medication, that's been helping a lot.
Good, yeah. Drugs are what we
Yeah.
do for pain. Okay, what makes it worse?
Probably like just any small movement and when the medication wears out.
Okay, and what does the pain feel like? Is it sharp? Is it like a deep ache? Stabbing?
Kind of like a stabbing.
Stabbing?
Yeah.
Okay. And does it travel anywhere?
No, just in that general area.
Okay. Well, I want you to be sure to ask for that pain medication. Okay, really important that you take that. Okay, I'm going to go ahead and check your head. Just check over here to see how everything is. It looks real good. Can you pull your lip down for me, please? I'm going to check skin color. Your skin color is nice and pink as far as that goes. I'm going to go ahead and check your eyes. If you could just look straight ahead for me, please. Okay, and then follow my finger for me, if you will, please. I did pupils equal round react to light and accommodation. When I shone the light into his pupils actually went from about a 5 to a 3 on the millimeter scale. When you have a pen light, you can see that on the pen light. Now the accommodation is by moving an object closer and watching the pupils constrict. You know, David's young and he's able to follow my finger. With many patients, you're not going to be able to test accommodation because they're not going to be able to follow your finger adequately. So in that case, just go ahead and leave it off. Now I'm going to look at his neck veins, and I'm looking to see if his neck veins are bulging, because that could possibly be overhydration. Actually, they're pretty flat. They look good. So I'd say neck veins are flat, and I can check my bed for the angle. And basically about at a 30-degree angle. And then I'm going to check his skin turgor, and I do that on the sternum. And I pinch right here, and I see how long it takes to come back. And the skin turgor returns within 1 second, so he's pretty good. He doesn't seem to be dehydrated as far as that is concerned. Okay, I'm going to check your skin temperature. I'm going to use the back of my hand. It's warm. And I'm going to check capillary refill on his fingers. If he had nail polish, I would check on the pads. And the capillary refill returns bilaterally in about 1 second. I'm also going to check his radial pulses bilaterally, and I'm looking to see if they're strong and regular. Most of the time you're going to have to check these separately. But they're strong and regular bilaterally. And then if it is regular, I'm going to check the pulse for 15 seconds. And it's the heart rate that you actually see on the board, which is the 116. Okay? Can you squeeze my fingers for me, please? Squeeze them hard. Okay. Actually, his hand strength is a little weak bilaterally, might be from the pain, but I'm looking for unequal hand strength, possibly for a stroke or something along that line. Never offer more than one finger because they can actually hurt you as far as that goes. I'm going to go ahead and do some auscultating now. And if you could take some deep breaths in and out of your mouth for me, please. Good. Could you lift your gown up for me, please, so I can listen to your heart? Now the apical pulse is generally below the left nipple, so I'm going to listen there. I'm listening for a lub and a dub, which is a clear S1, S2 in this case. And then I'm going to go and grab the right middle lobe. Deep breath, please. Thank you. And then I'm going to listen to the 4 quadrants of the stomach. I think you're hungry, huh? Vowel sounds are present, but they're hyperactive in the right upper quadrant, hypoactive in the other quadrants. And then I'm also looking at his dressing here, which is dry and intact, and you'll notice that I've dated and timed that dressing also with my initials when I changed it. Okay, I'm going to press a little, and I know you've been hurting there. How does it feel? Still got some pain there? Okay. And his abdomen is soft. His abdomen is soft, which is good. I'm going to go ahead and look at the lower extremities now. You always want to assess right on the skin, so I'm going to take his socks off. And I'm going to check skin temperature with the back of my hand. Capillary refill on the toes returns within 1 second. Pedal pulses are generally kind of where the shoelaces would be. Nice and strong and regular. Strong and regular. I'm looking at his feet all over for skin breakdown, for edema and swelling. And can you push up against my hands, please? Leg strength is strong bilaterally. I personally prefer to do Hohmann sign, what I call passively. Any pain when I do that on your calf? How about here?
No.
So basically, I'm looking for pain on dorsiflexion, which could be possibly a Homan sign, which could be a thrombus, so we do check it from that perspective. Okay, I'm going to turn you towards me. I'm going to check your back. How you doing, okay? Ouch. Put the pillow under your head. It's really good for you to get off your back when you can, and certainly take deep breaths with your incentive spirometer. Okay, some deep breaths in and out of your mouth, please. And then I'm going to check his back for any breakdown, for edema. That looks good. You can go back on over if you like. I'm going to take a look at his IV. His IV's intact. And have you been urinating?
Yes.
Good, good. And have you had a bowel movement yet?
Not since the morning.
You had one this morning? Okay, good. And what did that look like? Was it hard or soft?
Well, soft.
Okay. And was it brown?
Yes.
Okay. Okay. Okay, good. I'm just trying to think if I missed anything from that perspective. No, I think we're in pretty good shape. What I'm going to do is I have a transcript of the head to toe and a checklist. If you need it, you're welcome to email me. My email is educate100@aol.com. If you email me, I'll be happy to email the explanation of all the assessment parameters and a checklist. Thank you so much.